Scott Simpson.
Sir, it's a great pleasure and a privilege to rise in support of Dr Hutchison's motion to debate this report of the Health Select Committee. Sir, so many people who watch the proceedings of this place often criticise members in it for their partisanship, for their lack of detailed analysis of issues of the day, for their pettiness and for sometimes the shallowness of the debate that takes place here. So, as a new member, sir, with no particular expertise in health matters, to find myself sitting on the Health Select Committee and participating in this very full inquiry came as something of a very pleasant surprise to me. Because, sir, as a new member, I've found that a select committee process that can work to achieve a significant, historic and very, very important outcome for the future of our nation, not just the young people, but for the whole nation, is a rare and special privilege indeed. And so, without any particular health experience other than as an occasional user of the system, I found that some of the information that was presented to me to be overwhelming in its compelling nature, to be so logical and sensible as to be undeniable in terms of its capacity to be accepted, introduced and acted upon. And so, particularly, the work of Nobel laureate Hickman was particularly compelling, and the evidence is overwhelming that investment made in the very early years of life is an investment made in the whole of life. And that is a benefit not only to individuals, but it is an absolute benefit to us as a society and a nation. And Dr Hutchison is completely correct when he says that that doesn't mean there need be any less focus or spending on the health needs of those who are at the other end of the life spectrum or the life cycle. And so this report has been exceptionally well received, as Kevin Haig indicated in his contribution to this debate. And the fact that it has been so well accepted and acknowledged from all parties of the House, and indeed the media, the public and health professionals around the nation, I think is an absolute credit to Dr Hutchison and his contribution to leading this work. For without his vigour and enthusiasm for this project, I don't think it would be that we are now debating this matter in the House. Sir, no child deserves a bad start in life, and it's often said that a child of one is a child of all, and then it's also said that investing in children pays a dividend in good and productive citizens. So these are sometimes mantras that are often sort of touted around the place without any careful analysis of what goes behind them in terms of actually achieving a practical outcome and turning mere slogans into something meaningful and beneficial to individuals and society. And so to have us here in this Parliament of New Zealand today debating a unanimously agreed report of the Health Select Committee on such an important topic is indeed an historic and momentous occasion. This report, sir, has been very long in its gestation. Public submissions closed in May 2012. The report, sir, is far-reaching. In fact, there are actually two versions of the report. There is a full report and then there's sort of a report light. I commend those who want to take a view of it without getting into the real nitty-gritty of it. Read the report light. It's very compelling. It's an easy read. It's absolutely logical and coherent, and it makes a compelling, an overwhelmingly compelling case for the recommendations, the 12 major recommendations and the 130 more detailed recommendations that the committee has presented. Sir, it's an absolute privilege to have sat on this committee during the course of this inquiry, and I just wish that more of our fellow country folk could see the work that was done on that committee and would understand that actually the work of this Parliament occurs in weird and wonderful ways, often in ways that doesn't meet with public approval, but on this case we can all, as members of the Parliament, be enormously proud of the work that this committee has prepared. I commend the motion to the House.
Barbara Stewart.
Thank you, Mr Speaker.